I'm Stella, and I'm the chair for the webinar today. Thank you very much for joining us today in this special World Mental Health Day planning session as part of the Mental Health for All webinar series. My name is Stella again, and I'm a chair for this session. Just a brief introduction. I've been with the UNDP Health and Development team as a policy analyst, and I'm also an advisory board member for the Global Mental Health Action Network. As we all know, on the 10th of October, we celebrate the World Mental Health Day. And this year's theme is Mental Health is a Universal Human Right. So we have with us today a very impressive panel from Mental Health KAFE Nigeria, Trisuli Plus Community Action Group, Nepal, and the World Federation of Mental Health, UNICEF, and of course, the United for Global Mental Health. We have them here to highlight the work being done around World Mental Health Day, outlining opportunities for collective action, and discuss the impact that we can all achieve by working together to drive meaningful action on mental health for all. So without further ado, let's start with a round of introduction from the panelists. Can we start with Sarah? Sarah is the CEO and co-founder of United for Global Mental Health. Sarah, please.
Hi, yes, thank you, Stella. As you said, I'm the CEO and co-founder of United for Global Mental Health. It's an organization that was set up to increase political and financial support for mental health around the world. And we're the secretariat for the Global Mental Health Action Network. Thank you very much.
Thank you. So thank you, Sarah, for the introduction. Following that, can we have Deborah? And Deborah is the founder of Mental Health KAFE Nigeria. Deborah? Deborah, can you hear us?
It looks like maybe her screen has frozen, so yeah.
Hi, Deborah. Would you like to introduce yourself?
Yes, my apologies. Somehow I just got disconnected, but I'm glad to be back. Hello, everyone.
Good to have you back.
Yeah. My name is Deborah Adenekinju. I am the founder of Mental Health KAFE. We are an organization that's focused on mental health promotion on the African continent. So really our mission is to champion change in the mental health landscape and narrative on the continent through catalytic collaboration. So really looking at multi-sector stakeholder engagement, multi-level strategies, but really the overall goal is to address different system-level factors in order to bring about mental health promotion in Africa. And I'm so happy to be here. Thank you.
Thank you. Thank you very much, Deborah. I think we are waiting for Achut, but I guess we will start and kick off the session first and Achut will join us when he can. So thank you very much for the introduction. So I will just have a quick run through of the agenda today. We will have the first round of sharing from our panelists on what is happening with regards to the World Mental Health Day, and we'll follow that with audience discussion, where panelists will comment and answer the questions from the audience. So everyone, please feel free at any time, post any question that you may have in the chat, and we will follow that with a quick round of key takeaways from the panelists and then the closing. So we'll kick this off with the pre-recording from our first panelist, Catherine, who is the UN representative for the World Federation of Mental Health. Catherine could not join us for the webinar today, so we will play a pre-recording from her. Thank you.
I can't hear her. I don't know if everyone else can.
Yeah, there's no audio, unfortunately.
My name is Catherine Getsby.
Yeah.
I'm a representative at the UN for the World Federation for Mental Health. I want to thank you for joining us today, and thank you for letting me share a little bit about my work with the Federation. First, I want to tell you a little bit about my why. So I got involved in global mental health almost 20 years ago. So I'll be celebrating 20 years of my nonprofit, iFred, next year, and I'm really grateful, and I've had so many wonderful opportunities and met incredible people along the way, including Dr. Gabriel Ifbajaro. I met him at the World Health Organization's MHGAP Forum. He is the Secretary General of the Federation, and I'm really grateful to be a part of this organization because they have been doing work in the mental health space for 75 years. It's our 75th anniversary this year, and if you can think back to really the brave folks that started talking about mental health 75 years ago, I mean, I think even in the last 20 years, we've come such a far, and even 5 years, we've come so far with working on stigma so that people feel more comfortable talking about mental health or mental health challenges, and are able to get the support they need. You know, of course, we still have so far to go. We have such a large treatment gap. There are human rights abuses happening all over the world. So we have a very long way to go. And yet these people 75 years ago, being brave in that moment of time to say mental health matters, and we're going to connect and do something about it. That's why I'm so proud to be a part of the Federation. And again, 75 years is a long time to have been in this work and in this space. So I really do hope you can join us on October 10th. The Federation sets the theme for October 10th every year. And as you may know or may have heard, it's mental health is a human right for all, must be a human right for all. We so sincerely believe in that message. I so sincerely believe in it. You know, mental health is as important as physical health. There is no mental health without physical health or without health. So believe that's true. I was a part of getting mental health incorporated in the Sustainable Development Goals. And you know, we're moving along, but we still have a long way to go. So it's really important that we all join together in this single day of solidarity and messaging around mental health. Again, a universal human right. So we would love for you to go to World Mental Health Day, WMHDofficial.com. That's the name of the website where we have all of the media toolkits, the activations, what we're doing around the world for World Mental Health Day. We ask you to join us. We ask you to post on social media that day, share your stories, share your experiences, share how you are activating your own community around the theme, making mental health a human right for all. We would love and appreciate that. I'm so grateful to you all for your advocacy and work. I'm someone with lived experience. I lost my dad to suicide when I was 18 years old. And I care so much about changing how we think about mental health and ensuring all get access to treatment and feel loved, and that we make innovations in the work that we're doing around mental health treatments and support. So I'm really grateful to each and every one of you for the work that you're doing, and I'm really looking forward to connecting with you all again live, and just want to say thank you. And please do join the campaign October 10th this year. We'll put the website in the link, but thank you so much for joining us, and thanks for all you're doing all over the world. And thanks to United Global Mental Health, you all have been doing some tremendous advocacy and really help driving change and helping shift the conversation and how we even talk about mental health. So thank you all so much for your work. Have a wonderful day, and I'll see you online on October 10th. Take care.
So that was Catherine. So we have some comments. I hope the volume was all right. But yeah, we take note of that for the next pre-record. So we will move on with the second panelist for today. So that would be Sarah from Yeah, Sarah. So, yes, I do have we do have questions for Sarah. That So for Sarah, how has United for Global Mental Health celebrated World Mental Health Day in the past? And what did you achieve through your campaigns and activities?
Thanks, Stella. I think maybe a bit of background. So World Mental Health Day, as Catherine says, the theme is set by the World Federation for Mental Health in conjunction with many other organizations through a poll. And the key UN agencies that tend to drive the action for World Mental Health Day are WHO and UNICEF, but many other UN agencies recognize it, and an increasing number of governments and nonprofits and for-profit organizations all recognize World Mental Health Day. I think in terms of our work, what we've been doing since we started as an organization launched in 2018 is trying to increase the number of people taking action on World Mental Health Day around the world, and also trying to increase the kind of political significance of the day and get more decision makers involved. So in the early days of our work, we worked on video addresses by the UN Secretary General, a campaign which highlighted that every 40 seconds someone in the world dies by suicide, and getting different world leaders to talk about that. More recently, we worked on what's called a virtual March for Mental Health with a whole range of organizations around the world. This was during COVID when we couldn't do anything in person, and so we arranged for 24 hours of action online, and each hour a different country would take actions, or a different group like LGBTQ community. Overall, United for Global Mental Health itself, honestly, World Mental Health Day is so busy that we don't always do a dedicated event or activity on World Mental Health Day. Some of the activities that happen around World Mental Health Day include the ministerial meeting on mental health, which happens every year. This year it's in Argentina, and it's taking place on the 4th and 5th of October. So we participate in that, and in fact, I'm on the advisory committee as the civil society representative each year for that. In terms of what we do and what we've learned, I think our organization is very focused on advocacy at global level and supporting advocacy nationally. But as the Secretariat for the Global Mental Health Action Network, we are keen to promote everyone's work, not just our own. And so through the Global Mental Health Action Network, it's all about promoting partners and the work that is happening around the world. I think what we've learned from doing this work is that in a really good way, World Mental Health Day has become much more widely known and celebrated than it used to be. I think mental health is better understood, better recognized, but also, unfortunately, thanks to COVID, there's been just a lot more conversations around mental health. So we can see World Mental Health Day is becoming a bigger and bigger day each year. I think the challenge we have is that everyone tends to do their own thing with their own message. So, and to be honest, I don't think that's necessarily a bad thing, because every country has different needs and different issues that are affecting them. But sometimes that makes global action more complicated because everyone's got their own priorities. This year, the theme is around human rights, and that's something obviously we can all unite on. And it's really, really important. But I guess I see it as our role to support people to do whatever they think is best to highlight World Mental Health Day in their country or context. And we're here, well, to provide support and help make it a good day and a good campaign. Thank you.
Thank you very much, Sarah, for the sharing. So yeah, that was very informative. With that, we will move on to a pre-record from Tosin from UNICEF. So the question that we have for Tosin is, what is UNICEF planning for World Mental Health Day, and how can other organizations get involved globally and nationally? Okay, so while we wait for the pre-record, we will proceed with Deborah. So Deborah, sorry that we're moving on to you now. Are you okay to share? So what can you tell us about your brand new mental health resource map for the African continent, and how can others contribute to this?
Of course. Thank you so much, Stella. And I am more than delighted to really share about the resource map that we have coming up for World Mental Health Day. But just before I get started, I would also like to provide a bit of background. As I mentioned earlier on, Mental Health KAFE is focused on mental health promotion on the African continent. And it's really looking at different factors that are affecting mental well-being of Africans, looking at from the systemic level, from individual level, community level, like what are certain things that are affects, for example, the treatment gap, like what are certain things that we need to address in order to promote the mental well-being of Africans. And one of the major things that my team and I found out was the issue of access to resources. But there's so many different factors that are actually contributing to that. We know that although there's a scarcity of mental health resources, and there's a scarcity of like professionals and organizations, that there are those who are present on the continent that are actually doing the work. But what we are seeing is an underutilization of these services, and we wanted to know why. So we had a way of doing our own preliminary search to understand what are some reasons behind this. And one of the major things that came up from the data and also from anecdotal evidence, being able to speak to other individuals on the continent, my colleagues, individuals with lived experiences, was the lack of awareness around the resources. And for me, that was personally very heartbreaking, because it sounds like the individuals who are very passionate about this work on the continent, the individuals who are fighting within their own individual communities to create organizations, to work with the government, but somehow we don't know about what's happening. And I think to also go back to what Sarah had said initially is that we're now seeing individuals having their own priorities, right? I mean, we are all on the continent, even individuals within the same countries. There really wasn't much communication or awareness of each other. And one other major thing to sort of bring up outside of like partnerships with other organizations is the fact that the issue around stigma around mental health right now on the continent. So much work has been done around awareness and increasing acceptance, but we are still at the stage right now where we are trying to combat as much as possible the stigma around mental health diagnosis, or even just misconceptions and myths about that. So what you see is that compared to other parts of the world, you don't see as much communication around, oh, here's this mental health resource that I'm using, or here is therapy for this, like here's them, we don't see as much communication happening around that because there's so much stigma that's attached to it. So this issue of word of mouth or referrals, we're not seeing as much of that happening. And I will say that again, in the recent years, that we've seen so much innovation happening around technology, right? We've seen it, especially since COVID happened, we've seen so much change happening, innovation around like digital mental health, for example. And we've just seen a lot of technology being used to advance different areas and different factors, and I want to say Africa's development ecosystem. So for us, we thought about the fact that if individuals can now go online and go on Google Maps to figure out the best place to go shopping, or the best place to go dancing, and the best restaurants around them, why should the individuals have the same access to a database for them to understand what mental health resources are actually around them? We felt like that was really key, that if technology is being used to really further different development sectors on the continent, how can we tap into the same resource? Because even though we're still struggling with the availability of it, there are those that do exist. How do we now increase awareness? We also know that the research shows the link between increase in awareness of resources and the increase in the utilization of resources, of services. So really our goal with this map is to create a comprehensive map of mental health resources on the continent, right? We're thinking from advocacy to thinking of emergency response for individuals who are going through distress, to thinking about institutions who are focused on research or capacity building. We want to make sure that individuals, regardless of what their needs are, have the opportunity to have this one-stop shop, as much as we possibly can make it that, this one-stop shop where they can honestly get resources. So for an individual who is going through distress and is hoping to get like immediate response, they can look and see, okay, what hotlines are available in my country, you know, or to a mother who is trying to find a special ed school for her kid who is autistic, being able to understand what are the different resources or schools that are around me. Do I have a neuropsychologist who's available? Where do I go for diagnostic services? We want to make sure that we are addressing this barrier to access, right, or to awareness by having this database that becomes like a resource hub for individuals across the continent. And it's, you know, it's really our hope that it's a beacon of hope, you know, because it can be a little bit overwhelming sometimes. And as a person with lived experience, to know where to start from. And what we want this to be is that this map becomes exactly that. It's a place for individuals who now have the awareness of what they're going through. They now have the language to be able to speak about it, but it's having a very hard time in being able to locate resources. We want them to have a place to start from. But we also want this to be a place where, as again, Sarah mentioned, organizations can now become aware of each other. We want to be able to promote collaboration and partnership on the continent and across. We want them to be able to say, oh, wait, I'm an organization doing work around gender-based violence, and here is someone who is maybe 3 miles away from me who is doing work around with teenage girls and their mental well-being and education. How can I partner with them? Because when we pull together our resources, what we see is a multiplicative effect. So rather than having institutions working in silos and typically duplicating each other's work, we also want to amplify what each other are doing for there to be actual partnership. And to your question about how individuals can actually contribute to this, we are launching the map on World Mental Health Day. So that's October 10th. Our team has been working very hard for months to be able to pull the data, to compile it. And we are urging, we are imploring, we are asking that when this map goes live, that individuals, one, take the time to just look through it. Right, take the time to look through it and share it with their networks, share it with individuals, because you have no idea how important or how relevant it's going to be for a mother or a child or, you know, a teenager, a woman, a man, whoever it is. Share the map, because we want people to understand that there are in fact resources on the continent. There are people who are passionate and champions about mental health on the continent, and we can in fact utilize these resources. And we want people to also submit their form. So we're going to have a form where if your organization is not featured on the map, you can complete that form for your organization to then be included on the map. So individuals in your communities can be aware of the work that people are doing. And lastly, is just to really provide us with feedback, right? We want to make sure that this map is as user-friendly as possible. So we're encouraging individuals to tell us, what are your ideas? Do you think there's a better way to showcase these resources, better categories? But this has to be a collaborative effort. Like, this is a shared responsibility for Africans across the continent as well. And we're encouraging individuals to be a part of this movement with us. I hope that was enough information about the resource map, but thank you so much, Stella.
Thank you. That was fantastic, Deborah. Yeah. So so I have news. The recording from Tosin UNICEF is actually not working. So we will be uploading the recording on Circle, on the Circle platform. If anyone has not sign up for the Circle platform, I think we can share the link as well. And since we are a few panelists down, I will do my sharing. So I was told that as a chair, I can share as well. So this is very briefly, I did not have time to prepare. So over the years, so this is from the UNDP team. So over the years, in conjunction with the World Mental Health Day, the UNDP has launched our economic case for investing in mental health. So I can say our, we partner with the WHO and other agencies as well. So we launched the economic case for investing in mental health, or what we call the mental health investment case. So we kickstarted with the Philippines mental health investment case back in 2021. So that was sort of like the first investment case, and with, in collaboration with a lot of different stakeholders, and it was a success. And followed by other countries such as Kenya, Uganda, and upcoming ones from Nepal and Bangladesh, and other countries as well. So just very briefly, probably some of you already are aware of this work. Very briefly, mental health investment cases, what we do is it provides an economic case for governments to scale mental health system strengthening, including around equitable access to mental health care services. So by providing a return on investment, also what we call an ROI analysis, on a list of recommended WHO mental health interventions, or what we call, or what is known as WHO best buys. So, so this is just a very brief one on mental health investment cases. If anyone is interested, I can share the links later. And then at the moment, the team is developing a digital health investment cases as well. And I am working on, actually, Deborah mentioned about digital mental health. Thanks for that. So I'm working on a digital mental health project. So looking at all the evidence out there on the efficacy and effectiveness of digital mental health interventions, because we want to first establish a very strong base of all the evidence, whether it's actually effective or not. So it's digital mental health interventions, which includes digital behavior change interventions and wearables such as Fitbits and smartwatches. How it came about, this project, was that through our investment case work, this is a finding from across all the investment cases, and we all know that that there's very low investment, like what we found that among developing countries, like governments spend just a mere 2% out of the total health budget on mental health. And also we've also found serious shortages in mental health workforce across countries. So since we found that, okay, this has been the prevalent theme, so just trying to think outside of the box on how we can address these gaps. So once we have, so through this project, when we establish the evidence base, very strong evidence base, then we can, based on that, to develop an evidence-based protocol for interventions, for policies and programs for governments on digital mental health interventions. So this is more on like on the policy side of things. So yeah, so not doing like grassroots work, but yeah, we do try to really try to get things on the ground. And yeah, if anyone is interested, yeah, feel free to get in touch to know more. So I have more questions for our panel. Okay. So the questions are yes, we have questions for our panel. So there are more. So the first question is, there are more activities taking place for World Mental Health Day. How can we ensure that these activities are impactful and drive meaningful change? Would either Sarah or Deborah like to take this?
I think I can take it from a global level and Deborah from a national level, perhaps, or a regional level as well. I mean, from a global level, I think it's a really good question because it's hard to measure sometimes global campaigns and global success. In the early days, we were measuring success in terms of the number of political leaders around the world who talked about mental health, and then also about media coverage of the issues. So in 2018, it was about the launch of a report called the Lancet Commission on Global Mental Health and the Sustainable Development Goals, and we were running the launch of that. I think going forward, how you measure success really depends on what your advocacy objectives are, and Deborah has given some. We know many partners use it as a moment to bring together government and non-governmental organizations to try and press for action, and perhaps to get an announcement of changes, perhaps in the law or in ways in which investment, as you said, Stella, which is woefully low. So I think every country will measure it differently. And in some places, and in many places, to be honest, it is probably part of a bigger effort, which again, Deborah mentioned, around changing attitudes and beliefs towards mental health. and having a moment where as many organisations as possible in the media try and break down stigma and discrimination around mental health simply by talking about it. And I think that's a really healthy thing, to have a World Day for mental health, which is an excuse, if you like, to talk openly about mental health and to have that opportunity. So I hope that helps.
That's great. Thank you, Sarah. So the next question is for Deborah. So what are Mental Health Cafe's plans for the dissemination of its resources? I think it refers to the one you mentioned regarding, yeah.
Absolutely. As I mentioned earlier on, this is a shared responsibility. We've identified a need, and our team is working very hard to get this resource available. But I think that when it comes to dissemination of these resources, this is really going to be how engaged other individuals, other organizations going to want to be a part of this. So we mentioned that, again, we are a team, and we have our epidemiologist, Mia Sari, and we are looking online to see, okay, what's available, what can be a part of the map. But you have to understand that we can only get so much, right? There's only so much that we can be able to pull or compile. And this is where we're really looking for individuals to say, one, we want to be a part of making sure that these resources are available to those in our community. How do we do that? We are going to be sharing the map as part of, awareness campaign. We're going to have it on our website, because we have our website and we can put it on there. But my guess, actually, I know for a fact that individuals that are, again, grassroots organizations actually going within these communities, those who are communicating with individuals within the Ministry of Health, like whatever different space that they're in, they carry more weight. Their words carry more weight. Like, they are seen as the experts in this space. So we can have this resource map that's highlighting all the different ways that organizations can partner, all the different ways that individuals can receive support. But if I'm not hearing from the local university, for example, I'm not hearing from the grassroots organizations in my own community, I'm not hearing from my own healthcare providers saying, hey, by the way, I noticed this, and that. Have you had access to this map? Do you know about this map for you to even see what's available to you? We need there to be engagement and ownership from the ground, like there has to be that level of excitement about this possibility of having individuals across the continent having access to hundreds of resources. And again, we are really serving as the hub, right? We're not creating these organizations, we're not on the ground providing like direct services. We simply want to amplify what others are doing, but to amplify it, we need to have access to information about these resources. So we would do our very best, right, in being able to share with individuals across our own social media platforms, saying, hey, here's what we're doing. We're always excited to collaborate with organizations like United Global Mental Health that are, again, centered on this idea of partnership, sharing our resource and map on a platform like Circle, because we are literally having access to hundreds of individuals across the globe. That's what we are going to be doing. But our reach, we can only go so far. We are one organization, and we really want to tap into this power of collaboration to then create and to increase awareness around these resources. But we are honestly it's a call to action, really, for people to know that the dissemination of this map is not up to us. It's a we thing. Okay, we have to come together as a collective to say, this individual in my community, they deserve to know about other resources. What can I do about it? And we're hoping that people can join this movement and respond to this and have ownership of the dissemination of this map. Thank you, Stella.
Thank you, Deborah. So we move on to the next question. How can community level activities from World Mental Health Day lead to national policy change? Very good question. Who would like to take this?
I think I know of some countries where World Mental Health Day has been a moment to announce changes, or for, as I said, for different stakeholders to come together to announce change. So I think I need to think back about specific examples, but I know countries such as Sri Lanka, where there's been moments where it's been really important to bring people together around World Mental Health Day. So I think that is a helpful moment. The challenge of World Mental Health Day is it's one day in the year, and political processes don't always land on that day. So I think it is, as I said before, it's a good way of raising awareness. But if you think about the fact that in the past year, 4 countries have decriminalised suicide, but that's a huge achievement. And part of what is achieved on World Mental Health Day, as I said, is raising awareness of the issues and driving change. But maybe Deborah has other examples.
Sure, I can chime in, and I think that specific topic of decriminalizing attempted suicide. So I can give the example of Nigeria right now. I know an organization, Nigerian Mental Health, has so far been working very hard for the past couple of months, actually more than months, to decriminalize attempted suicide in Nigeria. And what they've been doing in like the lead up to World Mental Health Day is having different Twitter spaces, for example, different dialogues where they invite individuals from the health sector to the media sector to individuals that are working like within the Nigerian mental health program to say, hey, how can we have sincere, authentic dialogue about what's going on? What's the responsibility of the private sector? What's the responsibility of the public sector? Like, what are we doing? But at the end of the day, we've seen that for grassroots organizations to be able to do the work that they have to do, we need to have policies and legislation in place that actually support and create a nurturing, a sustainable environment for them to do their work. But the work that's been done on this grassroots level, in the community level, the data that we find, the evidence that we see towards the effectiveness of certain interventions are then what feeds back to inform the policies that have been created. So with this particular issue of decriminalizing attempted suicide, we have seen so much mobilization around grassroots organizations from Sunshine Series and Nigerian Mental Health and across different sectors, actually. And they're having conversations with individuals at the Nigerian Ministry of Health and saying, hey, we need to have that dialogue. But sometimes it's tricky, right? Because we can fight, and we can do so much, but sometimes it's a little bit hard to change things like policy and legislation. But I think it's that continuous effort to not give up. But again, coming back to this idea of collaboration, intentional partnerships across different levels to say, hey, how can we support the work you're doing on the policy level? How can you support the work that we're doing on the grassroots level, like on the community level? What can we do to support each other? But I want to say dialogue. Sometimes we don't realize that the work that we're doing or reaching is in high places, but they are. And it's being intentional about engaging these individuals to hear, okay, what are your issues around having this policy be in place? What are some barriers that you're facing? How can we support you? And how can you support us? But again, it's going down to the very fact that we all are in this together, and we have to move with that understanding and with intentionality behind collaboration for policy, for interventions, for programming, to whatever level it is. There has to be that intentionality behind it.
Such great answers. I'm learning a lot myself from both of you. Indeed, as highlighted by Deborah, the dialogue is so important between policy and grassroots level, the importance between top-down and bottom-up approaches. And Sarah has, very well highlighted that this is not just one day. This is not just a one-day effort on World Mental Health Day. It has to be an ongoing effort after this. So, which follows to the next question. How can I get policymakers to get involved or take notice of my World Mental Health Day campaign?
It's a really good one. I think there's some practical things. I think in the first instance, one of the things we've really encouraged partners to do is reach out to global agencies like UNDP, WHO, UNICEF, UNFPA, if they exist in your country, because they may well be doing activities to mark World Mental Health Day. They may well be doing those with government. And then if you can be involved in that, then you have an opportunity to be engaging with government directly in a space that can be quite helpful. So having worked for WHO, we used to always organize events at country level with the appropriate governments. So I think that's one option. I think a second option is thinking about if you do something directly with members of parliament. So the people that, if you're a voter, members of parliament should in theory be listening to you. So speaking to your members of parliament, doing an event with them, or some level of activity, or maybe something locally where they live and where they represent. And similarly, thinking about something in the media and making sure that that name checks the government or officials government ministers that you want to take action, so that it's picked up by the news monitoring that I assume that the government will be doing. Because most of them will be monitoring for mentions of their organisation, and then kind of compiling clippings that are produced for the minister. Having worked as an advisor to a minister in the past, I think what I'd say is they're quite busy and it's quite hard to get information through to them. So think about how to make what you want to say quite succinct and to the point and relevant for them, either in their work, either as because they're an elected official, or because it's something that they're working on, or something that they personally could be interested in. I hope those are some helpful ideas.
A lot of helpful ideas. Thank you, Sarah. So this is the next one is for Deborah, a lot of interest for Mental Health Cafe's work. So what has been Mental Health Cafe's biggest challenge when developing the new mapping resource?
Oh, that's a great question. Believe it or not, it's been finding the resources. I think what we've realized is, yes, the organizations that are doing this work, but sometimes I think we as experts in this space or professionals in this space, we know the language to use. You know, we know the search terms, we know what certain things mean, but we don't always think about the language on, I want to say, like, how would you describe this disorder, or how would you describe your services to, let's say, a layperson, for example. And so what we found is when we look up common terms related to like mental health conditions, we're not seeing organizations showing up. So we've had to go back to really look at our search terms and then actually make adjustments, because what we're seeing is like organizations are describing the services that they're providing, but it's almost like they're speaking to experts in the space. The words that we're using to describe certain disorders, a lot of times I don't see them being contextually relevant. I understand the need of using language that appeals to a global audience because organizations want to be seen as being a part of this bigger movement. But we have to be aware, organizations have to be very aware that they're providing services to individuals in their communities. How do they describe, how do they see the services? What are certain words that actually bring up conversations around certain topics or services? And for us, we started off like having like, things very broad, and we're like, we're not finding these resources. We're using terms that we think, someone in need would use, a mother would use, an elderly person would have to like look up, thinking, okay, I don't really know much about this, but where do I start from? So we almost have this bias, I want to say. And so it's been a little bit tricky for us, because we're seeing that, yes, there are resources, but the amount of deep dive we've had to do to find those resources, it's been a little bit tricky. And I think on another hand of it is that we're realizing that by the time we find organizations, they have done so much work, but I want to say their social media presence is very limited. And that's not to, in any way invalidate the work that they're doing, but for individuals to be aware of the work that you're doing, aware of the service that you provide, there needs to be that presence. So, not everyone obviously can afford having like a website, for example, and that's okay. But how can you tap into social media? How can you have an Instagram page or Facebook page that's actually active and providing information about the work that you're doing? So we sort of like seeing, like, I guess those would be like the two biggest things. One is that organizations are not using, I want to say, culturally sensitive or contextually relevant language to describe the work that they're doing. Hence, people in the community looking for those resources can't find them, because they're not describing their work using words that are relevant, language that's relevant to the community members. On the other hand, we have individuals who are doing amazing work, And again, grassroots level, community level, from capacity building to training to task shifting to advocacy work, so much. But we're not seeing enough presence on social media or on their website, or they do have a website, it's not really showing much, or there's no contact information. There's no email, there's no number. It's like, okay, how do people get in touch with you? How do we learn more about your work? So that's been, I think, the challenge for us so far. Is being able to really collect these resources. And obviously another part is like us not having access to like a big database, right, where we can just like pull all these resources. But that's why we're creating the map, is to fill that gap, is to say here's now the spot where all of that's there. But it's been challenging, but it's also been a learning process for us, being able to adapt the way we look for this resources, the way that we find relevant resources, the way they describe the work that they're doing. And we're learning. We're learning. And that's why, again, we're calling out to individuals to please support by filling out the form, so we know about the work that you're doing, and we can let people know about the work that you're doing. And hopefully it gives organizations also a chance to think about, how are we describing the work that we're doing? Are people in our community aware of us? And if not, how do we amplify that? How do we engage our communities to know that, hey, we're here for you, we're doing this work, for them to be able to say, okay, we see you and we're coming to you, right? For us to come together as a people and actually create a mentally healthy Africa. I hope that answered the question, Stella.
Indeed, wonderful. I think there's a lot of interest for sure with the resource map. And as mentioned by Deborah, the link is already available. So feel free to fill in the form. And there's the email as well if you want to reach out to Mental Health Cafe. So I will move on. We would actually like to hear more about what is Global Mental Health Action Network doing for World Mental Health Day. So we have Divya here with us. So Divya, would you like to speak on the work?
Thanks. Hi everyone, my name is Divya. I'm the Global Mental Health Action Network Coordinator. And as many of you know, the network is all about collaboration, inclusion, and collective action. And in that spirit, our plans for this year to highlight and amplify the activities and campaigns that members are developing to mark the occasion. So we'll be putting a spotlight on the plans that are taking place at a community level, nationally and regionally, to allow members to find opportunities to work together for greater impact. So if you want to let us know what you have planned for World Mental Health Day, please share them in the chat and head over to our community engagement platform Circle, where you can share plans and chat with members in real time as well. So I'll share the link to join in the chat. Thank you, Sarah.
Thank you, Divya, for sharing. As mentioned, the link will be shared. So feel free, will be shared shortly. So we will move on to the next section. It will be on the key takeaway session. So we are inviting our panelists to sort of complete this sentence with a tweet length answer. So the sentence is, to drive meaningful action on World Mental Health Day, we must. I will also write down the sentence here so everyone can see. So either, who would like to go first, Sarah or Deborah? Deborah looks like she's ready, so would you like to go first?
Sure. Okay, I will. Tweet length, that's hard. Okay. I want to say that to drive meaningful action on World Mental Health Day, we must center and prioritize equitable partnerships. I think hopefully that's a tweet length. But yes, I would say prioritize and center equitable partnerships. Again, just to give a little bit more on that, it's both thinking about like the global north on a global level, but also on a national level, local level, is that we need to make sure we have multiple stakeholders representing different communities, different groups, always at the table, especially on a global level, that their voices are representing continents and LMICs and regions that we don't often hear about. for us to be able to talk about change on a global level, we need to make sure that the people at the table are truly representative of a global audience. So I would say that center and prioritize equitable partnerships. Thank you.
Thank you. Very, very concise and meaningful. So are you ready, Sarah?
Yes. I think so as Deborah said, actually my first thing was to drive meaningful action on World Mental Health Day. We must unite to make our voices heard, which I think is a similar sentiment to what Deborah said. And I think reflecting then back on today and what we've talked about, I think in practical terms, to drive meaningful change or meaningful action, we must persuade decision makers to announce new action to uphold human rights, because that's what we're trying to do. The rights of so many people are currently not being upheld when it comes to mental health. It's a really important theme for this year. So, but overall, I think we've all said the same thing, which is about uniting or supporting one another to make our voices heard.
Thank you so much, Sarah. So yeah, with that, I would like to thank all the panelists and Divya as well for sharing with us on this in this webinar on their actions and initiatives surrounding World Mental Health Day and beyond. And highlighting how Global Mental Health Action Network members and other stakeholders present today can support and collaborate together to drive meaningful action on mental health for all. We really appreciate all the audience members who are here today. I see a lot of chats and a lot of feedback, so appreciate all of that. And yeah, and for spending this time with us, 1 hour. So it has made this webinar very meaningful, and let's all continue and keep this conversation going on the Circle platform. So do we have the link for, yes, we do have the link in the chat to sign up for Circle. And yeah, let's all continue the conversation there. So I would also like to remind again, the next webinar will be on the 31st of October. And it's titled World Mental Health Day Reflection. So it will be reflecting on what are the takeaways, the key takeaways from World Mental Health Day, and so do keep an eye out for announcements. Yes, so we have a lot of really positive feedback. Thank you so much again, panelists. Thank you everyone who is here with us today. So with that, we end the session for today. Thank you. Have a great day.